From WLWT, this is Issues.
Hello everyone, I'm Courtis Fuller and welcome to Issues. Today we're going to talk about a very important subject, and that is health. And there is an event taking place in October. It's called the First Lady's Health Initiative. This is the second year for it, and with me to talk a little bit more about that is Dena Cranley, the First Lady of Cincinnati, and Barbara Lynch, the First Lady of New Jerusalem Baptist Church. First of all, welcome to the program.
Thank you for having us. Good to be here.
This is the second year. Let's go back for people who aren't familiar with this, who might not have been involved last year, and talk about the purpose of this, how it got started, and the success of last year.
No, you can talk about how it got started.
Okay. Well, we, it really started with First Lady Barbara Lynch's son and a phone call. And we, he said, well, you're not the only First Lady in town. There's First Lady Regina Lynch, and he, wanted us to meet and have lunch together, and we did, and we talked about burning issues in our community, and along with First Lady Daphne Baines, and that led to more and more ladies coming to a meeting at my home, and health was a burning issue among the ladies, as well as infant mortality and just the health disparities we have in our community overall. And so we decided to, have a health day and focus on family. And so this is our second year where we, have a family health day across churches in our community. And really our mission is to educate and connect our resources to, educate and connect our community to resources so that they could take charge of their health. And it's really about promoting health literacy and hopefully, reducing the health gap in our community through that promotion. And so we're very excited to host our second annual Family Health Day. And last year we screened nearly 2,000 people across 18 host locations, and approximately 600 were children.
That's impressive. Health is talked about in church, but not talked about at this level. Would you agree?
I agree with that. I think this whole collaborative has given us an opportunity to kind of take a deeper dive into health and to give us more direction. We talk about health, yes, because the Bible talks about us being healthy in all kinds of ways, but this gives us an opportunity to really reach the people where it's most needed. There's such a big gap in the health disparity in Cincinnati and probably all over the country, where the longevity is like 20 years difference in longevity in some areas of our city and other areas of our city. The cancer rate is so much higher in some areas of our city than in other areas. And so when we look at that, we wanted to do something that would make some kind of impact. And we think the place to start is education, exposure, giving the people the tools to work with so that they can take charge of their own health.
Because, years ago, people were afraid to talk about what's ailing them, if you will, and to get people to understand that it's okay. Don't be afraid to go to the doctor. I remember my mom, her blood pressure would start to go up anytime she had to go to the doctor. And I've heard other people say that, and it wasn't so much that she was afraid of the doctor. It just seemed like it just made her nervous to go. And
I think people, if they think that if they don't know,
right,
then they're better off. Yeah, what you don't know won't hurt you. Yes.
Yeah.
Yeah.
But that's changing. So
it is changing.
So this year is bigger and better in many ways, in the sense that you have more churches involved.
Yes. So we have 35 participating churches at 22 host locations. So we have some churches coming together. For example, in Avondale, we have the Church of the Living God that is a host location, and they have Southern Baptist, and Rockdale clustering with them. The same with New Jerusalem Baptist Church. We have El Bethel Baptist clustering with New Jerusalem. So it's all about unity and coming together and doing something on the same day, where we're able to kind of pause and think about our health and bring the entire family And we also have our screenings are, you know, one of the unique things about our health day is that we have follow-up appointments. So if there are any abnormal screenings, or if someone's experiencing depression, we do have behavioral health screenings, that they can make an appointment immediately on the spot.
And this is all free?
Yes,
free, yes.
all free.
And I think that's what impressed me most. A lot of times, for whatever reason, people aren't seeing a doctor. Here's one opportunity to really go and get checked up, checked out, and see what's going on in your health world. And then, as you said, if you needed to make follow-up visits, you could.
Yeah.
You said a lot of kids were screened?
Yes,
600.
yes. So Children's Hospital is a great partner of ours, and as well as Kroger and UC Health and the health department, and 45 other partners: Mercy Health, Christ Hospital, Tri-Health, St. Elizabeth.
How did you get them all to do that?
There's so many. There's too long to list. I mean, too many to list.
I mean, there was
say.
a buy-in to the concept, obviously.
There
if you
was.
had.
And we were ourselves were elated and surprised that we had no problem getting people to partner with us. We had people calling us asking if they could partner with us. It speaks well of the Cincinnati community too, that everyone wanted to come together and work for this cause.
I want to talk about, because this is, I don't know how rare, I mean, to do an initiative like this, but rare that all of the first ladies of churches, and it's not all of them, but many would get together like this. Talk about how just getting them together.
It was by word of mouth. As Dena said, that the initial meeting was at her home, and each first lady was asked to invite another first lady, and we did that. And very few ladies couldn't, and those who couldn't were probably because of work issues or health issues or something of that nature. But in churches, we are faced with these health problems all the time. We do the bedside visits and the hospital visits and the funerals when they are, but as first ladies, we are the persons that, beside our husbands, that the people talk to about their issues. And so we realized this was an important issue. And also we realized this was an area that perhaps we could really do something about.
We're going to take a break and come right back and talk a little bit more about the various screenings that will be available to you. The date on that is October 9th, Sunday, October 9th. We'll be back in a moment. Welcome back, everyone. I'm Courtis Fuller. We're talking about an event coming up October 9th, Sunday, October 9th, and it's all about health. It's a women's initiative, churches involved, 35 churches involved, and it will take place at 22 locations, all of them at churches.
Except for one. The one's at Seven Hills Neighborhood House.
In the West End.
In the West End.
And they're working with the churches in the West End.
What challenges did you face pulling this all together? Because it sounds like a huge undertaking.
Yeah.
I think the challenge was that Barbara and I are we're pounding the pavements, and so we needed some new shoes. This is too good to be true. I think there were a lot of partners who were trying to get their foot in the door with the churches, and the idea that we could come together without turf wars with the hospitals, and that it was through the church. I think we just didn't have any. I can't think of any big challenges that we couldn't overcome. I mean, I think the message was unity and coming together as one voice and with one message on taking charge of your health. And I think when you come together, I think you're able to really move mountains versus everyone working in silos.
I think one of the points that Dena made too was that a lot of those agencies had been trying to get into the churches, and this was an avenue for them to do it.
Were you surprised at the number of people who came out? I know that you wanted people, but obviously they were buying into this concept too, to say, you know, I do need to get checked out. Did that surprise you? Or, I mean, obviously you're happy about it.
We're very happy about it. No, I don't think so. I don't think we were surprised. You have to realize that we're talking churches that have an audience already, and pretty much if the pastor says this is good to do, they trust the pastor, they trust the First Lady, so they'll do it.
Yeah.
And we're making a deeper dive into the community this year too, because this is not just for the churches, it's for the broader community too.
I know the mayor, and I know Reverend Lynch talks a lot about these issues of health and disparity. But now you're seeing it in a firsthand way. The numbers are a little shocking. I think that sometimes people might glance over them. They hear us reporting about these disparities in the news, but these are real
They are.
and troubling. You know, in a city like ours. And but this is one way of working toward
Yes,
solving.
and I think, you know, the bigger picture is, you know, this is about health, but, you know, at a deeper issue, this is about connecting with the community. It's breaking down barriers. It's dispelling myths and stereotypes both ways. And I think one of the big feedbacks we received, or the most consistent feedback we received last year, was thank you for meeting me where I am. Thank you for coming into my neighborhood. And I think that's a key cultural piece that we often forget about. And, you know, I have a Middle Eastern background, and a person coming to my home means more than me going to their office. And so this is almost like a home. And I think that's a huge cultural piece that sometimes we forget about.
And this goes from the youngest to the oldest. I mean,
Exactly.
did you, was there any particular group of women that came more, older, younger, or across the board?
I think largely it depended upon the congregation
Okay.
and the age groups in the congregation. I think we probably reached the people between 40 and 70 more so than anything. Yeah.
I'm familiar with that.
With that demographic.
Talk a little bit about some of the tests and that people can screenings that they can actually get.
God, there's so many. There's HIV, asthma, diabetes, vision screening. We have dental vouchers,
Blood pressure,
yeah.
behavioral health. Some churches offer hearing tests.
Is it something that you would sign up? I'm just thinking that someone would say, I want to test this, and this, and then they would walk through, or how do they select the various?
Yeah, tell them about our innovative
Yes. So we are, no, it's open to the public.
Okay.
So anyone can just walk in and get screened.
So you don't have to pre-sign.
You don't have to
Okay.
sign up for
That's
anything.
good. That's
The only
good.
thing I think they're asking for the sign up is that we have all the mammography units out, and so to sign up to get a mammogram. This year, you know, some churches are using a paper format where they could get all their screenings recorded, any follow-up appointments needed. And we are also piloting an electronic passport where people will get a QR code, and so that when they go up to get their glucose, it's scanned and the results are put in. If it's abnormal, their appointment is put in, and at the end of the health day when they check out, they can get a printout of their results as well as any follow-up appointments. And so we're piloting that at 9 churches.
We're excited about that.
Yeah.
But the important thing too that people should know is that there are no names attached, so they don't need to worry about being in a database or anything. So it's all anonymous.
It's
yeah.
all anonymous. And it helps us then look at what the health priorities are by zip code.
Right.
And that we can then provide health programs throughout the year in those neighborhoods. And another key thing we're piloting are follow-up calls. So, you know, it's all about, as I previously said, it's about connecting with the community, because there's such a distrust of the medical establishment, and that, you know, some people don't make preventative care a high priority, or there's a lack of access. And so we're offering follow-up calls on a voluntary basis. If you volunteer, United Way and the health department will make quarterly calls just to ask you how your goals, we ask them about what 2 goals they'd like to fulfill in the next year. And we just follow up and see if they're working towards their goals. And it's continuing to connect with that individual throughout the year and after Health Day. So it's not just a health fair. And, you know, research has shown that there's an improvement in overall health when you continue to connect with that person and working towards health goals.
Excellent, excellent. We're going to take another break and then we will be right back. Stay with us. Welcome back, everyone. I'm Courtis Fuller here with Dena Cranley and Barbara Lynch. We're talking about First Lady's Health Initiative. It's an all-day event, October 9th, at various churches around Greater Cincinnati. 35 churches involved, 22 locations throughout the city. We were saying people don't have to sign up, which is important. I mean, it's just that day and it's open to the public. I want to underscore that, because if people, maybe they don't belong to New Jerusalem, but if they live in that area, they can come.
Right. Yes. We have huge yard signs out. Welcome to the public. Yeah.
I would imagine, looking forward, at some point you might even get produce an app or something that you're talking about the follow-ups. Maybe that's the next frontier, as they say.
Not a bad idea, Curtis.
Remember, it started right here.
It started right here.
We'll give you credit.
Well, no, but no, I was thinking
That's a great
because now
idea.
everyone has the smartphones and things like that, because that follow-up is key. Did you do some of the follow-up this past year? And
No, this is something that just kind of popped in. You know, we want to be more than just a health day. And I think that, you know, when you are thinking, well, you know, how can I, you know, improve my health? And why not have this conversation every 3 months saying, hey, how are you doing? You know, do you need any help? Do you need any resources to help you achieve your goals? We're here to, and coming from the First Ladies for Health just has a different spin to it. There's that nurturing, you know, you have the ladies and there's a nurturing quality to it. And I think that we're hoping it works. It's a pilot, so we'll see.
Did any churches develop any kind of health programs throughout the year, and maybe not necessarily as a result of that, but maybe inspired by that?
I think this whole initiative has sparked an interest in having other events during the year. Now, most churches do have health and wellness ministries. Some of the smaller ones don't, which was another advantage too, because then the smaller churches could link into what the bigger churches are doing, and we could mentor them and help them with it. But just this past Sunday at my church, we had the Dr. Ball, who is the dean of the Medical College of UC, come to our church, and instead of having a sermon for 8 and 11, he talked to us about cancer.
Yes, I know. I heard.
So those kinds of, we're hoping those kinds of programs will be ongoing throughout the year for all of the churches.
And this past Saturday, Lee Chapel had the UC Health mammography unit, and they screened 15 ladies, 15 mammograms. So it was a great day at Lee Chapel.
At some point, do you hope to produce a report? You were talking about getting some of the stats. At what point do you think you might produce a report? Again, here's
who's going to write that report? Yes, we will.
That'll take more work. That'll take place at the same time that app.
Right.
No, but I would imagine that you're getting so much information back there.
And we do. We share it with all our partners, and you just inspired me that maybe we should actually share it, you know, publicly too. But yeah, we do share it with all our healthcare partners. You know, the data results from last year, and you know, one of the disadvantages of a paper profile is not everybody fills out all the information, or they don't necessarily, the screeners didn't put the results. You know, I think everybody's, you know, I think some people are afraid to openly admit that they're smoking because smoking has become such a taboo. And some people may smoke 5 cigarettes a week and think that they're not smokers, you know? I mean, it's just a different perception. Everybody has their own perception of how they define themselves or their health. And so I think this year, you know, you strategically think, okay, well, maybe the asthma and lung will be in a quiet corner so people can, you know, talk about whether they smoke or not, or, you know, with HIV, we've become more strategic this year in where the screenings are. Like, for example, HIV, we looked at diagnosis from 2013 to 2015 and thought, okay, well, St. Leo's Catholic Church in North Fairmont doesn't really need HIV screening because there were 0 cases from 2013 to 2015. So maybe we could go to a neighborhood where there's a high, you know, a higher diagnosis of HIV. So we're trying to be more strategic, and so we should share that information. I think that's a great idea, and the data, and the data.
And we don't have enough time to even answer this question, but obviously now with the heroin epidemic, that is an issue that is a health issue, obviously, and a social issue that it might not be addressed specifically, but I would imagine, again, that's, you know, when you take on these challenges, the wall gets bigger and bigger and bigger.
Yes.
I guess I shouldn't mention walls.
No, we're breaking down the wall.
We're breaking down barriers. All right. Hey, this is Sunday, October 9th, 35 churches involved, 22 locations. It's a great event. The second year for that. Do I go to a break now, or do I? All right. We will take a break, and then I'll be back to wrap things up. My thanks to Dena Cranley and Barbara Lynch. The First Ladies Initiative, Sunday, October 9th. You'll find out more information on our website, WLWT.com. I'm Courtis Fuller. Have a nice day.